Hi, welcome to Pathology Riddles. In the previous episode, we discussed about etiology, life cycle, pathogenesis, and clinical features of malaria. Today, we will discuss the laboratory diagnosis of malaria. In hematology, we diagnose malaria using thick and thin smears. How do we prepare a thick smear? It is preferable to do this test before the treatment with antimalarials. The blood is taken by pricking the patient's finger. One drop is taken on the glass slide and spread using the edge of another glass slide to an area of approximately 12 mm square. The slide is then placed in Copeland jar containing distilled water in vertical position for 5 to 10 minutes. This step is done to dehemoglobinize the thick smear. The smear becomes colorless and then it is air dried. It is stained with Leishman stain. Thin smears are prepared similarly to blood smear and stained with Leishman stain. So what do we see under the microscope? In Plasmodium vivax, ovale and malari, we see all the asexual forms, that is ring form, late trophozoite, schizont and sexual forms, that is gametocyte. But in Plasmodium falciparum infection, we see only ring forms and crescent shaped gametocytes. This is because the schizont and the late trophozoite of Plasmodium falciparum are usually within the capillaries of internal organs. Also note that the ring form of parasites are early trophozoites. See in this image. Since Plasmodium vivax falciparum are the most common parasitic infection in India, we have shown them here. From MBBS point of view, it is enough if you learn to identify the ring form and gametocytes of Plasmodium falciparum. The ring form of Plasmodium vivax is seen inside the RBC. The red dot is the chromatin. Malarial pigment may also be seen in some RBCs. They appear as brownish spots. In Plasmodium falciparum, you can see multiple ring forms in one RBC. This is called a cold form. It is diagnostic of Plasmodium falciparum infection. In this image, you can see two ring forms and also the gametocytes of Plasmodium falciparum. It is crescent shaped with chromatin in the center and malarial pigment dots around it. The morphology is more clear in thin film, so it is examined first. If the parasites are not found in thin film, then thick smear should be examined first. Once the parasite are detected, then more thorough examination of thin films are done in order to identify the type of parasite. Another method to identify parasites is to use quantitative Buffy coat or QBC test. In this, the blood is drawn in a capillary tube which is stained with acridine orange. The tube is then centrifuged at 12,000 rpm for 5 minutes in order to separate the components of blood into layers based on their density. The parasites are then examined at the RBC and WBC interface using ultraviolet light source. Since the parasite containing DNA take up acridine orange, this appears as a bright speck of light against the dark non-fluorescence RBC. This method helps in faster detection compared to slide method. Here also you can see the quantitative Buffy coat. The parasite will be seen in here, somewhere at the junction of Buffy coat as well as RBCs. The next method of detection is rapid diagnostic tests. The principle of this method is to detect malarial antigen in lysed blood. Immunochromatographic method are employed in this technique. If you see the strip, it has a sample area where the sample is added. Then there is control antibody area, anti-plasmodium falciparum antibody area, and anti-malaria antibody area, and at the other end is a absorbent area. So the blood is first mixed with a hemolyzing compound. This is either done before adding in the sample, or in some kits there is a buffer solution which contains a hemolyzing compound in the kit itself. The buffer solution also contains an antibody labeled with a marker like colloidal gold. So once hemolysis takes place, the parasitic antigen is bound to this antibody with the marker. The labeled antigen antibody complex moves towards the 3 detection line containing the captured antibody to parasite antigen by capillary action. The capture antibody that detects malaria contains antihistidine-rich protein antibody. The capture antibody that detects all malarial parasite contain anti-parasite lactate dehydrogenase antibody. The test takes about 5 to 15 minutes to complete. Depending on the test results, we can detect if it is pure falciparum infection or a mixed infection by 2 or more parasite or negative. The other findings that we see in malaria infection is in histopathology. In spleen, there can be marked increase in size. Cut surface may show gray or brown pigment. Microscopy will show red pulp congestion and hyperplasia of macrophages with increase in splenic size. Liver may also increase in size. Microscopy will show Kupffer cells hyperplasia and malarial pigment deposition. Bone marrow, lungs, subcutaneous tissue and lymph nodes may also show malarial pigment deposition. Remember, it is important to detect malaria as Plasmodium falciparum can be rapidly fatal and can cause death of the patient. I hope you have understood malaria in short. If you have any questions, do ask in the comment box and share it with your friends. That's all for today. This is Dr. Bismay signing out till we meet in the next video.